The NMC OSCE marking criteria update on May 24, 2019 has included a new skill called administration of inhaled medication. This is a simple skill to demonstrate, and you can deem to be lucky if you get this skill for your OSCE exam. It is more talking than doing. Error chances are very much less when compared to skills like ANTT. In this video, we will see more about the skill of administration of inhaled medication. We will explain this skill in the following manner. Broadly, we can classify administration of inhaled medication into pre-procedural phase, procedural phase, post-procedural phase, and also we will discuss about some key points to be noted while performing this skill. In pre-procedural phase, we will talk about metered dose inhalers, capsule dose inhalers, and powdered medication inhalers. In procedural phase, we will discuss about introductory phase, assembly of things required for performing this skill, and the drug administration part. Please watch the whole video to get a clear picture about this procedure. First, we will deal with the pre-procedural phase. You will be given 5 minutes to read the scenario. Read the scenario properly. Look out for education aspects mentioned. Check whether the patient is using inhaled medication for the first time. Check for any diluent medication if mentioned. Inhaled medication device can be of 3 types. They are metered dose inhaler, capsule dose inhaler, and powdered medication inhaler. Metered dose inhaler. In this, preset amount of drug will be inhaled when the patient is pressing the canister. Capsule dose inhaler. Sometimes a capsule may be prescribed which you have to place inside the inhaler, press the cracking switch, and then the patient needs to inhale the medication. Powdered medication inhaler. In this case, medication will be in powdered form inside the inhaler, which needs to be shaken well before usage. There is no canister to depress. Patient can directly inhale from the inhaler after shaking it well. Usually, a metered dose inhaler is given for you to administer to the patient. It will be clearly mentioned in this scenario. You also need to check the medication type, dose, number of puffs needed to administer, etc. during this time. The next phase is the procedural phase, which has 2 steps in itself, introductory phase and the assembling of things. In the introductory phase, check for scene safety, approach the patient only after ensuring that scene is safe to approach. You have to introduce yourself as a nurse taking care of the patient after doing a hand rub using the 7 steps of hand hygiene. There is no need to verbalize these 7 steps as it is clearly mentioned in the OSCE marking criteria. Confirm the patient ID using 3 checks: full name, date of birth, hospital number. Provide privacy to the patient. Ask the patient whether he or she has been resting for the past 20 minutes. Tell the patient that you are there to administer his inhaled medication. Ask the patient whether he has used inhaled medication before. Ask the patient about allergy and pain. After gaining patient consent, move on to gather things for administration of medication. Regarding the assembling things, you need to read aloud the prescription, including the person, drug, dose, route, date, and time of administration. Ensure validity of the prescription, signature of the prescriber, and legibility of the prescription. If any of these pieces of information are missing, are unclear, or illegible, then the nurse should not proceed with the administration and should consult the prescriber. Collect the inhaler with the mouthpiece, spacer device, and gloves in a clean tray. Do a proper hand washing using 7 steps of hand hygiene at the wash basin. After wiping your hands or drying it, take the tray to the patient's side along with prescription. Next is regarding the drug administration. Ask the patient whether he is comfortable and whether you can proceed with the medication administration. Reconfirm the patient using 3 checks, put on gloves, and start explaining the parts of the inhaler: mouthpiece, inhaler, canister, spacer device, and number of puffs to be taken. Remove the mouthpiece cover from the inhaler. Shake for 2 to 5 seconds. Attach MDI into end of the spacer device. The next few steps are the most important. Explain what the patient needs to do and clear doubts if any. Ask the patient to exhale completely and then grasp the spacer mouthpiece with teeth and lips while holding the inhaler. Ask the patient to tip head back slightly. Inhale slowly and deeply through the mouth whilst depressing the canister fully. Instruct the patient to breathe in slowly for 2 to 3 seconds and hold their breath for approximately 10 seconds. Then remove the device from the mouth before exhaling slowly through pursed lips. If you need to administer one more puff of the same medication, instruct the patient to wait for 20 to 30 seconds before inhalations. If you need to administer a different medication, you need to wait 2 to 3 minutes between inhalations. Moving on to the post-procedural phase, tell the patient that you will clean the equipment, make it ready for the next use, and you will come back. Clean the inhaler after putting a gloves with cleaner wipes. Keep it aside to dry. Do a hand rub, date and sign drug administration record. Come back to the patient. Health educate the patient about the usage of metered dose inhaler if required. Reassure the person that you will be around for 30 minutes and in case of any adverse reactions to press the call bell so that you can come back. Open the curtains or blinds, do a hand rub using the 7 steps of hand hygiene and leave the room. The key points to be noted in administration of inhaled medication are as follows. The important aspects include checking of prescription and reading it aloud, at least one hand rub using 7 steps of hand hygiene, identification of the patient at least twice, administering exact dose, the number of puffs, adequate pre-administration explanation of the procedure, current administration technique, documentation of administered medication with date and sign. To conclude, the administration of inhaled medication is one of the simplest skills that you can demonstrate in your NMC OSCE exam. If you make sure that all the key points are met, you have nothing to worry. If you like this video and you think that it needs to be shared with your friends who are preparing for the NMC OSCE exam, please feel free to do so. Subscribe our YouTube channel for updates on NMC OSCE. Our website where you can get all the study materials for NMC OSCE is www.oscetrainer.com. Thank you for watching.